We're talking about medical miracles today. The advances are astounding. We think, don't you think it's pretty astounding? I do too. I thought y'all would. There's even a new procedure that can actually make people taller and save limbs that might otherwise have to be amputated. Look at this. Kelly Lockett was born with a birth defect, making her right leg much shorter than her left. Her parents went to dozens of doctors. Some wanted to amputate, but they kept searching. And then they met Dr. Paley, an orthopedic surgeon who said he could save Kelly's leg. He is one of a handful of doctors performing an extraordinary procedure that lengthens bones. The bone is surgically broken and slowly pulled apart in small stages. Because bone is living tissue, it grows to fill the gap. Kelly's results were dramatic. After just 3 months, her leg was already 3 inches longer.
I could never imagine talking to my daughter and saying to her, listen, there was a treatment out there, but we decided to amputate your foot. I could never do that.
Even more astonishing are Jillian Mueller's results. Doctors predicted that she would never be more than 4 feet tall. And after going through the limb lengthening procedure 3 times, she now stands 5 feet 2 inches.
It made life easier, a lot easier, because now I could reach things that I couldn't before. I could get around more easily, and just basic everyday living was made simpler.
Well, Jillian is here with her miracle worker, Dr. Paley, who brought this limb lengthening procedure to North America, and he performs them at the University of Maryland Medical Center in Baltimore. Would you have thought this could be possible years ago?
Initially not, but I was young and open-minded and probably unbiased at the time, so I would believe anything at that time.
Yes. So I heard that, you know, there are some little people of America who find this, you know, controversial or whatever.
Well, I think they're being very protective of their group to make sure that they don't end up with procedures that could harm them. And in the past, limb lengthening led to a lot of complications. I think with newer techniques, developments, we can now do it safely and reliably.
Wow. So if you're born with a child who is diagnosed as a dwarf, so to speak, or let's just say your child is diagnosed, you can change that now?
You can't change their genetics, but you can change their stature, you can correct their deformities, you can correct their proportion, and you can make their appearance be essentially normal.
Really? You say that he is your hero.
Yes, he is. He's changed my life in ways that when I was growing up, I never thought were possible.
Right.
I mean, I grew up, my parents were very supportive of me. They always told me I could do whatever I wanted to do. But so I didn't feel I was different, except I was shorter, but they didn't make me feel bad for being that way. And society out there sometimes does, but when I was home, everything knew I was fine and everything, but life is just so much easier.
Wow. Well, you say that very few centers can do this successfully and use external brace connected to the bone. Is that what you have there?
Yeah, this is there are many types of this device. This is called the Lazaroff device, which was the original one. It's a circular external fixator. It can take a bone that's crooked and it can gradually straighten it by adjusting the rods on the outside. If you wanted to lengthen the leg, you would adjust all the rods, so you'd actually be pulling these 2 rings apart.
So that's inside your bone? That would
the
be
rings are on the outside. The wires and pins, they go into the bone, and it's essentially a scaffold that the patient wears for several months, which allows you to reconstruct the limb inside the device.
What would that feel like on the leg, though?
I've never had one on.
And you were a child when you did.
I was 13 the first time I had it, and actually it was slightly different when I had it. Cause
Is it painful?
There's some pain involved, but all pain is relative. I mean, and people are amazed. They think that they can never do things. You're amazed what you can do once you're in that situation.
Absolutely.
I mean, there was pain involved, but was it excruciating? No. Was it something that I wanted to, that I just felt I couldn't handle? No. You just took it one day at a time and got through it.
Okay. So you say that this pulls bones apart 1 millimeter at a time, a day?
1 millimeter a day, which is a 25th of an inch. The patients turn these bolts here a quarter turn 4 times a day, which totals a millimeter. 1 full turn is a millimeter. And so it's a very small amount. They're going 1/100th of an inch 4 times a day, which is barely perceptible. And that's why most patients, after a week or 2 after surgery, after you've recovered from the operation, you really don't experience much discomfort, a little achiness, and mostly in the muscles at night, but actually the lengthening itself is not causing the pain.
Amazing, isn't it? Well, thank you so much. Thank you so much for being on here.